Thank you, Annie.
No problem.
Right. So, welcome back to another episode of ABA Mom. I am your host, Allie. And today we have a very special guest, Annie Chen, who is the owner of Behavior Roots. Annie, can you go ahead and just introduce yourself?
Yeah, so I'm a trauma-informed behavior analyst. I've been in the ABA field for at least 10 years now. I'm also a certified trauma breath coach, and so I incorporate that into my work with caregivers, with adults, with children as well. So whoever my clientele or any workshops I do, I incorporate a very holistic approach in my interventions.
That's awesome. Uh, can you just share just a little bit about how behavior roots behavior roots came to life?
Yeah, so I started the company 3 years ago now, I believe. And I recall that I had just become a BCBA, passed my exam, and I started the next route is okay, let me find a clinical job. And so I did start a clinical BCBA position at a ABA clinic, and I think within the first 6 months, I think it confirmed that I this is not what I wanted to do. But I think because I was still exploring my identity, I was like, oh wait, let me just try another company. Maybe it'll be different. Maybe if I just find one that aligns with my values, aligns with things that I find important for caregivers and for families, this will be it. That didn't work. This one was a remote online ABA company, and they were great, but I think the limitations that insurance provides just did not align with the type of quality work and service I wanted to offer families. So, whether that's even just a mindset approach, right? So, in insurance, we have to kind of justify hey, what are the deficits? What are the skills and behaviors that we want to decrease? It didn't sit right with me, right? That would be one example is what I want to focus on is self advocacy, independent skills, really focusing on not so much the deficits of what we need to decrease, but what can we teach them to help them become independent and help them advocate for themselves in the long term. And I struggled accessing that type of quality service in clinical work.
Yeah, I think that's really interesting because I think a lot of us uh, we would definitely see more than just behavior reduction, right? I think a lot of insurance companies and the clinical side, they're like, so what are the problem behaviors? What are you going to do to reduce that? And you can do so much more with ABA. So that kind of just brings me to my next question. So, what brought you originally into the field of behavior analysis?
Well, I actually originally wanted to become a family marriage therapist. I got my bachelor's in psychology, and I was like, oh, being a family marriage therapist, the hours and clinical route, it takes so long. And I couldn't find any career opportunities in Georgia, which is where I'm originally from. So I moved out to California and specifically San Francisco. And San Francisco at the time, I think ABA was a lot more progressive or just more well known compared to Georgia. This was obviously like 10 plus years ago. And I recall one company was like, hey, we'll train you completely, right? We'll pay you for the training, and this is what ABA is. I was like, all right, let me try it. It's still within psychology realm. And I think honestly, the first month when keep in mind, I'm so new to this, I have no idea what ABA is, but all I knew was all these scientific tools, and if we use them correctly, we can watch a child literally master a skill within 2 weeks, potentially, right? And I was blown away the fact that we could use scientific tools and we could see progress in such a short period of time and watch these kids become independent. So I think I was really impressed by that. And actually, soon after, that's when I pursued my master's degree.
Yeah, I love that. I love that too. I mean, that's really a part of what's drawn me into the field too, is seeing that progress. And I think too, that nuance, like when you're like, oh my gosh, like even though it's science, it feels
Yeah.
like magic. Like you've never seen
Yeah.
thing work like that before. It's like,
Yeah.
wow, that's so
So quickly.
incredible. Right. Yeah. Yeah. And that's so amazing. So yeah, I do think that's one thing that also sparked my interest too, is just seeing how quickly sometimes that these kids are able to master these goals. Like they are able to speak for the first time or have independent functioning skills. It's pretty amazing to
Yeah,
when you're first starting out. It's pretty awesome. It's still really amazing to see too.
yeah.
So one thing that was really interesting when we talked before is that you spent some time working in the foster care system. What was the experience like, and how did it shape your perspective on behavior and trauma?
Oh, a lot. So my role was basically the same thing. It obviously wasn't in a clinic. It was actually with a foster care company. We collaborated with the social workers and we were obviously the behavior interventionists. And, I would actually drive out. These are families like out in the boonies, like I'm driving like an hour to these families. It just depends on where the parent or the children are placed and whatever caregiver we're given. I think one thing I realized is, wow, I don't know much about trauma or emotions at the time when I was working with them, and I realized this is so different from a controlled clinical environment. Completely different. And I think we could agree schools are very similar. It's not this controlled environment where you are in control of these instructional control programs. It is so opposite. And I think I saw a lot of these behaviors that were, it started to make me question like, okay, this is not just a behavioral concern. There's so many underlying, history. And we had to keep in mind the fact that like there's some of these children are still seeing their parents who are struggling with, drug addiction or who knows what else. And we have to support them through that as well. That plays a part in our behavior support. That's not something we can just separate and ignore. So having to really understand, okay, I need to learn more about emotions, about trauma, about history, like their specific history, that everyone's history influences their present behavior so much more than we realize. And that's actually a big part of what got me slowly introduced into studying emotion, studying how it can be used as an intervention, even, and what that has to do and how that plays a part in our behaviors.
Yeah, and I think that's so interesting too, because I think in ABA we say like private events, so like the things that we can't necessarily see that are so obvious. So it's like, okay, so what's the antecedent for this behavior? Like, it's a really obvious thing would be, like access to tangible, like Johnny wanted the iPad, he was denied the iPad, right? But sometimes it's so much deeper than what we can actually see, what's actually going on in those private events. And then those kids that have had trauma, there's things that can be triggering that we may not even be aware of. So I think that's really important to us as professionals to acknowledge that we may not have all of the may not be able to see all of the antecedents, everything that happens before the behavior. Like those private events are also play a very important part in the child's and adults too, because I know you work with adults as well, so adults behaviors. So, what do you think that, because you explained a little bit about the traditional ABA setting, what do you think that after working with the fostered youth that we're kind of missing in the ABA setting?
Oh, a lot. I would say emotions for sure. And I just feel like we cannot adequately address behavior without understanding emotions and how they influence our behaviors. So I think, just if I just look at my own training, I certainly did not learn anything about emotions. I was trained to really just look at the external observable behaviors. And because of that, I'm not equipped to handle or even to know how to respond when a child is emotional, right? When it's very clear there are emotional triggers. And I think that just sets us up to be a very limited professional. I think recognizing how to address those internal private events is something that I didn't get training in. Recognizing how to approach from a holistic standpoint that, again, do we understand how behaviors are tied to trauma, for example? But if we're
Right.
not getting training on trauma, what that is, what that looks like, how that's connected to our behaviors, again, we're completely ignoring that piece. So it's not very we're not treating or we're not supporting the whole part of a child or adult. We're only focusing on one specific aspect, which can sometimes do more harm than good.
Yeah, I think that's absolutely right. And sometimes I think like we just mentioned before, it just kind of is missed. And sometimes us as practitioners, we're not trained for that. We're trained for what is observable. That's a huge part of ABA, like even down to like, what we need to provide for insurance, right? To not have any of those mentalistic terms. But I think it's good that background information is such an important piece to really understand the child or adult, like to understand the individual and what some of those needs are. Because I'll tell you, I don't have, other than a few workshops I've gone to, and I really don't have a lot of training in trauma. So there's definitely some things that I probably have been missed because I don't have the training for that. I can say like what's observed. I can, kind of base some things like on the background information, but there's some things that, I'm sure, we just sometimes it's like, man, I can't believe, I missed that. This was, a trigger for them, or this is something that they were experiencing that I didn't realize. So I know you've mentioned that after you became a BCBA, you were in a clinic setting and realized it wasn't for you. So what for you was missing?
I think it goes back to what I've been talking about. I think the holistic support. And what I
Yeah.
mean by holistic is I think with ABA sometimes, and I think this does depend on the practitioner and the personality of a person, but I feel like ABA almost like I became a very black and white thinker, right? A very like it's this or that. And it was very hard to get out of that until I faced my own health journey and realized like, okay, ABA is great, it's so effective, so helpful, but how we use it matters. And it's also not the only thing, right? And I think when I was able to open up myself up outside of the box to understand, okay, I need a combined act with ABA or breath work with ABA or just different modalities of understanding trauma or the nervous system. This is what made my interventions and practice so much more powerful and effective. Um, and I think just understanding like ABA is not everything. Because I think in our training, sometimes we're like, oh, we teach, you know, them how to mand and tact. And we basically are like the speech therapist or the feeding therapist. We're like this. And sometimes we're given those programs that we're like, do we actually know how to do all these things? And it's almost, and a lot of this falls under insurance, but we're almost convinced and taught that we're supposed to know it all. And ABA is supposed to be it all. We're supposed to be able to apply ABA to everything. But the problem is if we're only using ABA, that can, again, really limit us.
Right, right. Yeah, absolutely. And I think we do tend to get in that mindset, right? Like, oh, functional communication, we could do that. We can do the speech, like, oh, desensitization, we could do that. We could help you with food sensitivity. So you're right, we do. And I think that that goes back to, and I'm not even sure it's like the way that we're trained, because I know that we are supposed to find, like, if we don't have the background in a certain area, that we're supposed to seek mentorship in that area.
Mhm.
So I think in our field, sometimes we get stuck on our own island, but that collaboration is so important. So we should collaborate with a speech pathologist. We should collaborate with maybe it is a BCBA with lots of training with speech or something like that. So we should always be in collaboration. So we don't know everything. Sometimes I think we know everything, which there's a lot of things to behavior. I think there's a lot of components, in that clinical understanding that we can definitely support in, but it's not a one size fits all. Not one individual is going to respond the same way. So I think there's always room to grow in our field for sure. And ABA, as much as we want to say that it's the holy grail, I don't know that it's absolutely everything.
Yeah, I
But I
agree.
love that. Yep. But I love that you're bringing in that trauma informed care, because that is so important, and that breath work. too. It's such an important piece, and like understanding our nervous system, that's such an important part because it's all part of who we are as humans. So it's just such an important piece. So I think that I would love to see, some of your interventions. I think that it's fascinating what you're doing. And I know you talked a little bit that you've had your own experience with PTSD. How do you feel that your personal journey changed the way that you understand behavior?
Yeah, I mean, I think for me, when you're navigating complex PTSD, which is essentially you're navigating almost consistent trauma throughout your childhood. So it's this repeated small moments of exposure of that. Um, honestly, I would say 7 years ago, I was completely ignorant to emotions. I did not think about my emotions. I didn't think it could help me. I definitely did not care about taking deep breaths. I was just completely oblivious. And some people will say, oh, ignorance is bliss. Sure, but at what cost? And I think my cost was relationships, losing people that I loved and cared about, or not even knowing how to navigate a healthy relationship. I went through a divorce and so many other things culturally, being Asian American, that I think was just really difficult. And I realized I I was lacking a lot of emotional intelligence, for example. So emotions, again, played a big part in my journey and also my curiosity in how to integrate that into applied behavior analysis. Um, because I think a lot of times, I think about when we have behavior plans for children, especially the really big behaviors, those really big tantrums, or even the severe behaviors, we often don't understand how emotions are driving those behaviors. And that I could apply that to myself, right? So, for example, it took me a long time to take my BCBA exam, and I didn't realize that the whole 2 year, no, 5 years, I can't remember how many years I put it off, was actually driven by fear and anxiety and perfectionism. And that's all emotion based, right? But those produce specific behaviors of procrastination, of ignoring and running away from my problems, of blaming people and putting it on other people and projecting my problems on others. So I think having to navigate that and going through a lot of hardships kind of forced me to look at like, okay, I've applied ABA in my life. It's been really helpful. But when you go through something like trauma, you have to dig deeper than
Right.
that.
Yeah, no, I think that's a really great point too, because I'm sure extrinsically you were motivated, right, to like take the BCBA exam because then what? Then you're a BCBA and like, but like all of the things that took you um to get there, like, what was the cause of that? But I think that's really important piece to know the emotions behind that, which is something that, in traditional ABA that we don't typically talk about. We say that they're private events and like, but they're not observable, they're not measurable. There's something that somebody can tell you and share with you. One thing that I will say I think is very helpful is the ACT curriculum in the ABA field, because I think that has opened us up to a little bit more of those private events and the acceptance commitment therapy, like kind of recognizing some of those emotions, being able to let things go. So I think that that's been a good way um, for us as practitioners to access and measure some of those emotions and also be able to work with individuals, which I'd say it's probably the closest that we have to cognitive therapy. So, and I know you've had some, you've taken some ACT courses and earned some CUs. How has ACT influenced your personal life and your professional work?
Oh, ACT has honestly really changed my entire
I
practice. And yeah, and I think I'm sure many others would agree if you study it enough, if you actually practice and apply it enough, it truly changes your entire approach. Whether that's creating the interventions for your children and parents and anyone else, but I think it's surprisingly, it aligns with breath work a lot because breath work focuses a lot on mindfulness, and mindfulness is simply knowing how to be in the present moment. It's not meditating for an hour, it's not being quiet, not emptying your mind, it's just simply noticing. And ACT really focuses on that as well. It's, sometimes I do dialogue meditations and they're like, oh, it didn't work, or like, I thought of
Right.
this. And I'm like, that's okay, right? The goal is not for you to not think. I want you to tap into what you're feeling, what you're noticing right now. How is that feedback? How is that data to you on what's going on with you right now? I think ACT is really good at doing that, along with many other things, but also in particular, managing those emotions that we talk about, right? And thoughts. Like a lot of times growing up as children or adults, we're not taught how to manage our emotions. We're not taught how to have a healthy relationship, and certainly not a practical one. Like, what does that actually look like? And ACT is so good at teaching you, like, oh, this is how I should respond. Oh, what does acceptance or letting go actually look like? And it provides those applicable exercises to teach you how to do that. And I would say for me, I when I started learning ACT maybe a couple years ago, I would say that along with breath work combined, and I can't say for certain, I don't have like accurate data, but this is my hypothesis, is that breath work and ACT combined completely removed my insomnia that I struggled with for 30 plus years. And I say that because there's literally nothing else I was doing different aside from those two. And so it can be really powerful. We know the research proves that as well.
Yeah, I think that's amazing. Like and that's a lot of ABA too. It's like just making changes to our environment, making changes within ourselves because that's how we change behavior. We manipulate either what we're doing, like if we're self-monitoring our own behavior or changing our environment. So I think that's a really important piece too, because it's all ABA, just not the our traditional ABA. But I do love the ACT curriculum. I've used it with some of my older um clients that they just have trouble with that regulation piece, being able to kind of regulate their emotions. They go from very high to low, being able to kind of understand all those thoughts and feelings that they're having. So I do find it a very good curriculum, and I'm very glad that we have it in our field. So all
Yeah.
right. So also the trauma breath coach, I think that's exactly so what exactly is a breath coach?
So a breath coach essentially you're trained in a variety of different types of breaths to help usually facilitate or teach people for specific ailments. So it could be, I think a lot of people think, oh, breath is breath. I use it to calm down. That's
Yeah,
so not
right.
true.
A lot of people do.
Um,
Yep.
yeah, but I think like, a lot of times people don't realize like breath can help with very specific breath practices. Just like we would take medication or vitamins for very specific ailments, certain breath practices can be helpful for certain states. So if you're more tired versus if you're more anxious prone and you're ruminating and having lots of thoughts going around versus if you're feeling stuck and very shut down. So there's different types of breath for different types of states. And I think, it's so versatile. And I think that's part of what being a breath coach is you facilitate that and you help, at least on my end, what I do and how I integrate that with my work and clients is like I do their full assessment and intake. I look at what's going on, both internally, externally. And let's say a caregiver or a parent is struggling with like, I'm just overwhelmed, I'm depleted, very common, right? I look at, okay, what specific breath strategies can I teach them to regulate and facilitate their nervous system? And my goal is to always teach independent ones, meaning like they should be able to know how to independently apply this breath practice and they can apply it anytime, anywhere. And that's the amazing part of it is self, sustained. You don't need to depend on me. Once I teach it to you and once you know how to do it, you can do this anytime to help calm yourself so that you can be there for your child, for example.
Right.
I will say there's a difference between a trauma facilitated breath coach versus a regular breath coach, though.
So what are the differences between the two?
Um, Essentially, a trauma facilitated breath coach gets extra training in trauma and the nervous system. So just because you are a breath coach does not mean you understand trauma, that you know how to respond to somebody showing trauma signs, that you know how to facilitate that in a class or a group class. And so the difference is I got training in just not just the understanding of the nervous system, but all the basics of trauma, the different fight, flight, freeze, fawn responses. There's actually five, and understanding how that can show up even within our external behaviors, and then how to respond in a safe way to ensure that that person feels safe. It's all in the response. So making sure that we're not triggering this person or making their past triggers worse if they are experiencing a trigger or a panic attack, even. So just being trained in that and understanding how to read those behavior cues and how to facilitate those behavior cues in trauma.
Got it. Okay. That's very interesting. I do have a question about panic attacks. So I know a few people, so you probably look at like sometimes maybe like the cause of like a panic attack, like you've mentioned, like some of it maybe it's like trauma, or maybe there was some type of antecedent, like maybe like you've mentioned, like a parent like feeling overwhelmed. I've met a few people where the panic attack is just kind of, I'm going to say it comes out of nowhere because nothing comes out of nowhere, right? But they're like, I wasn't thinking about anything, I wasn't doing anything. And I wonder if it's just, and maybe you can answer this better, is it maybe sometimes like your body is having like a delayed response, or sometimes maybe I've seen some people like they're trying to just relax and then their body, they just can't relax. So I was just wondering if you've ever observed that, or if you've heard people say like I just kind of came out of nowhere, I don't know what happened or what triggered those panic attacks. Like what kind of ways do you have help those people in those kind of situations, or what have you observed about panic attacks?
Yeah, so I have worked with people who have had them. I also want to know I'm not a panic attack specialist in
Yeah.
terms of that, but I will say in terms of breath work, and nervous system, I think it's important to remember there's multiple factors and contributors that could where it could just come out of nowhere. One of them could be we're very disconnected from our bodies, and that's actually a lot more common than we realize. I'm even disconnected from my body, and it could be daily, and I need to actually check in regularly and do my breath work in order to be connected. So I think there's varying levels of how disconnected we can be. But often, what's paired with being disconnected from our body, which disconnection simply means we don't notice our symptoms, we don't feel them, maybe we ignore them, we suppress them, right? So often, what's paired with that disconnection is suppression of whether that's emotions or thoughts, some physical symptoms, maybe it's shoulder aches or anxiety even. So it doesn't need to be physical, it could be mental. Maybe you're more irritable, maybe you're rushing, you're on a go, go, go mentality. And before you know it, it's almost like if we continue to ignore and suppress these smaller signs that our body is like, alarm, alarm, hello, I need
Right.
help, what is it going to do? It's going to create a bigger alarm. It's going to create a much bigger one, such as panic attacks, where it's like, I can't do this anymore. Your body is literally shutting down or exploding because it cannot take all the suppression in some way. So that could be one potential cause or reason is essentially like you've been so accustomed, maybe you don't even realize that you've been suppressing other symptoms until something big happens like that. And then you're like, oh, okay, something's off now.
Yeah.
Um, that
I
could
think
be
that was a
one
really,
thing.
I think that's a really good answer, because sometimes I've known with like my own clients are like, I don't know what's happening, or like why my body's doing this. It just is. And I'm like kind of going through like in my analyst brain, like, okay, so what were the antecedents? And sometimes I'm like, they're really I don't have a specific thing for this, but I think maybe just over time, like not listening to their body being disassociated, things like that too. So I think that was a really great answer to that question. And like you're not a panic attack expert, but I think that breath work can prevent sometimes some of the panic attacks. So I think that's a really great prevention strategy too. And if you can figure out what causes the panic attacks, then I think that, that would be great. Then we can solve the problem. Um, and I know you've mentioned that you work with a lot of adults, including other analysts too. Um, is there a reason, like, do you prefer adults, or why is your primarily, I'll edit this. What is your primary focus on adults versus children? What has inspired you for that focus?
Yeah, I think I shifted to that when I started my behavior roots company, and I actually am very passionate about children. I've always loved children. There's something so innocent about them that you're like, oh, there's so much potential. And so I do still love working with children. However, I think when it comes to helping a child succeed, we know, especially as behavior analysts, that it's their environment that really sets them up for success. An
Right.
environment meaning it could be the caregivers, the teachers, their home influence, and just any adult around them. And I think, as much as I love working with children, and we got to see so much progress when you're a behavior therapist, you get to work one-on-one with them, which is great. But what happens outside of session, right? I think a lot of times when children are working with us one-on-one, it's great. But what I want to see is I want to see them generalize those skills across their life across different life stages with their parents, with other caregivers. And isn't that always our goal as behavior analysts? We want them to
Right.
generalize. But in order to do that, the caregivers and parents need to be part of that equation. And so when I was a behavior therapist, I often saw that lacking. And not to say, like, of course, there's always parents who are very willing, they do their best despite everything that they're juggling. But I truly believe that if we can teach the caregiver or the adult, that is the most guaranteed success for the child because they are, the child is with the caregiver most of their life, most of their time outside of school and therapy. And
Right.
I also want the caregivers and parents to be set up for success. It's not just the child, right? The parents need to feel confident. They need to feel like they know what to do when this happens. That to me is a successful family or a successful intervention in terms of our service. And this goes to behavior analysts or any other adults I'm working with, right? If I think about the PTSD and everything I went through and trauma, I was not ever taught or modeled or equipped with these skills, whether
Right.
that's responding to emotions, whether that's calming myself down and regulating and managing my anger, whether that's knowing how to communicate, right? Functional communication. And these are skills that I think we assume as adults that we should know. When we know in reality, if you grow up in a really disadvantaged environment, you're not going to be taught those skills. You respond however it was modeled to you, which then leads to a really unhealthy path sometimes. So for me, I'm like, can we teach adults healthy skill sets? Because then, whether you're a caregiver and it's for your child, or you're in a young adult who maybe hopes to work with children or have children one day, you are fully equipped with the healthy skills to manage anything.
Right. Right. Yeah, that's an excellent point. And then if you're trying to teach children how to regulate their emotions and the adults around them aren't even able to regulate their emotions, it's almost undoing everything that you're teaching. Because once that session's over, right? Or if like you're with them during school or you're with them part of the day, once that's over and they're with a caregiver who unfortunately doesn't have that skill set, it's very hard to continue when we're kind of being, unfortunately, I don't always think it's, the fault of the caregiver is sometimes it's just they just don't have the skill set or the tools weren't taught to them. And I think I had a counselor one time explain it best that parents give you the blueprints of what to do. And it's up to us to follow the blueprint or create our own blueprints. So
Yeah, I
um,
love that. Yeah, and
Yeah.
I think what you're touching on is co-regulation, right? That
Yeah.
is a more
Yeah.
psychology term versus ABA, but
Right.
co-regulation is a real thing. There's tons of research, and it's necessary for an adult to co-regulate.
Yeah. Yeah, it certainly is. And I think and it's a very important thing. And I love that you also mentioned that you do an 80/20 model with caregivers when you do work with children. So can you explain what an 80/20 model looks like?
Yeah, so 80/20 model just essentially means 80% I work with the adult or caregiver or parent, and 20% is with the child. So I don't think it's effective necessarily to not work with the child, right? Like I still want to build rapport. I want to assess them. I want to make sure I understand what drives them, what motivates them. And so that I can be almost that Rosetta Stone translator to the adults. So I think it's important that as the therapist, I get to know that child really well. I know what sets them up for success, and I provide that objective third party perspective. However, the meat of the 80% is with the caregiver because once I see what the child needs, what they might be lacking, what support systems that they might need from the parent, I translate that and I say, hey, caregiver, this is what I feel like would be really helpful to build a really close connection with your child, but to also understand them better, to know how their brains operate, their nervous system operates, that how they learn better. And my goal is to create a better closeness and connection within both the child and the parent. But I think a lot of times it's training the parents. And so that 20% often involves like maybe I'm modeling some of those strategies, right? And I am working or chatting with the child directly so that the parent can see what does this actually look like. So that direct piece is still really crucial. But at the end of the day, my goal is to hand it off to the parents and be like, hey, okay, your turn to practice. And that 80% is where we role play. We do the behavior skills training. We make sure that the parent feels confident in practicing and implementing these strategies. And sometimes it might be, oh, that didn't work, or I'm not comfortable, and we have to scratch it or we have to modify it. That 80% gives me space to play around with that, to make sure I'm fully supporting the caregiver to the best of my ability and to make sure they're succeeding too.
Yeah, absolutely. I think that's wonderful. And I know how hard it can be to get the caregivers training. So I think it's really important. It sounds like you kind of let them know like, hey, this is my model, that I'm going to be doing a lot of more training with you, like working with you. And I think that's an important piece to be upfront about that too with the caregiver. So how do caregivers usually respond when they find out that they're a large part of the training?
Yeah, that's a great question because I think it can vary, the response can vary depending on where the caregiver's capacity is, or how ready they feel, or how much self-work they've done on themselves, right? So much of those factors play a part. So I've had caregivers who I've been working with for over 3 years and they love it. They understand the value of the work that I offer them. And I even had one parent where their son was like, how come see Annie every week? And they're like, oh, we want to be better parents for you. We love you. We care about you. And that was just, my heart melted hearing that, but that's like my ideal thing to hear. Again, that's not always the case though. I think I've also had caregivers who initially was like, yeah, let's do it. And then they fall off and then they want to remove services. They're like, we're not interested anymore. And that's okay, right? It's not a bad thing. I think what that tells me is maybe they're not ready. Maybe they have other priorities or other problems and challenges in that present moment that's more of a priority. Or they're just not ready to face some of those things about themselves because my services really are very therapeutic for the caregiver, right? I tell them, like, I'm on your team, I'm your cheerleader, I'm your full support. I'm here to advocate for you. I'm not just here to advocate for the child, I'm here to advocate for you. And
Right.
that means understanding what your needs are, understanding from a therapeutic perspective what might what support you need that you might not have received in the past, or maybe even your history of punishment with ABA and how that might look different in our sessions. And I think that depth is not something that every parent is always ready for. And again, that's okay. but I get varying responses.
Yeah. Yeah. And I mean, I think you're absolutely right. I think what is a challenge sometimes for caregivers is changing. I mean, change for anyone is hard, but when you have to change something about yourself, or you're being asked to look at yourself, or maybe hourly, even if it's just like a
Yeah,
small change, even if it's like just take a deep breath first, right? Or give yourself a break. And it sounds really easy for parents to do, but it's like any change is hard in general.
yeah,
Like, so I can understand sometimes that parent perspective, and sometimes, they have other children, or they have a busy schedule, and this is just not what they thought, it would be. But I love that you're supporting them and being their cheerleader. I think that's such an important piece to know that they're supported. Um, so what does success look like for you now, both personally and professionally?
I think the definition of success has shifted over the years. Um, I think back then, success would have looked like having a stable full-time job with great benefits and kind of almost like what everyone else wants, and what feels safe, right?
Right.
Um, at least tangibly. I think that's shifted a lot as I've done a lot of the inner work. And as I've actually reached my success and fulfillment personally, I think now I define success as what values align with me, and am I living those values out? And am I seeing that tangibly in my everyday work or everyday personal life? So that
Right.
could be, if I value connection and being able to connect with my family, my husband, am I actually seeing that? Am I experiencing that on a day to day? If it's in work, feeling fulfilled in the sense, if my value is feeling I'm offering a service, and quality service to these families or clients or adults, do I feel good about the work that I'm doing? Is it moral? Is it honest? Is it ethical? And those are some of my values. And if I feel good about that work, I would say that's a success. If they're giving me positive feedback, that is icing on top success, right? But I think success will look very different for each person. But for me, it's certainly not so much of the external motivators, it's a lot of the internal motivators.
Yeah, I agree. I apologize. One second.
No worries.
My apologies. There's an alarm going off.
Oh
I have no
no.
idea. I was like, I didn't want to interrupt you. Okay.
Oh, it's
Uh,
okay.
no, I think that is absolutely um I think that's great that your successes changes, because that's what we're kind of supposed to do, is grow. And I love that you're venturing out and you're not always just doing what feels safe, but you're aligning your values, which I think a lot of people are afraid to do, because what if you fail? What if you don't succeed? So I think what you're doing is amazing. I'm sure you're helping a lot of people um, who who may not have the emotional intelligence, or may not recognize things about themselves. I know sometimes, when we're kind of like in ourselves, like we have trouble recognizing or seeing what other people see. Same thing with some of my older clients. They're like, why don't I have any friends? Or why can't or why do I feel this way? And I think it's important, because sometimes you just need like an outsider to kind of give you some of that. And I think you also have all of this with your trauma-informed care and your breath work, that you're bringing something really amazing into our field. So I'm so excited to see more of all the amazing things that you're doing for other people.
Thank
Um, so what would be, because Annie, you're all the way in California, which is a little far for me.
you.
What would be the best way if somebody wanted to reach out and get some coaching or consulting from you, would be the best way to reach out to you?
They can go to my website, behaviorroots.com with two R's. And my website actually has a variety of different ways you can contact me, or you can fill out the form at the bottom of my website. And you actually get a free 15-20 minute consultation just to, if you just need someone to talk to, honestly, or if you want to see if we're a good fit, that's where the free consultation comes in. And we go from there. If we're a good fit, then after we meet, then I provide them all the intake and forms that are necessary to get started.
One message you'd like caregivers, adults, or fellow BCAs to take away from this journey, what would it be?
I would say one of them would be on the other side of fear is fulfillment. And I think you kind of touched on this is like being scared this will happen or, staying in our safety zone. And I think there's actually so much out there when we're willing to take risks, small risks, right? Take small steps towards it. But I think often, whether it's worrying about like, what if, if I leave the clinical ABA field, what's going to happen? What if I don't get a, steady income or job? Or if you have a child, right? Like, what's going to happen? Are they going to be able to independently care for themselves growing up? Like, there's so many what ifs. And I think
Right.
we often forget that the what ifs is actually anxiety talking. That's not our real brains talking, that's our fear talking. The anxiety of like the what if or this happened in the past and I need to do this to make sure that doesn't happen again. And I think when we get sidetracked and we get stuck in that box of fear, that is ultimately what limits us and prevents us from not just growing, but accessing complete fulfillment and gratification of the things that we need and want in life, whether that's for our family or for ourselves. So I would say remembering that on the other side of fear is and can be fulfillment if we're willing to just step out of our comfort zone just a little bit.
I think that's a wonderful message. Thank you so much, Annie, for sharing today. I can't wait to hear more about your experiences and your growth and what you're really bringing to our field. Thank you so much for joining me today.
Thank you, Allie. Thank you so much for having me.